Being here in Georgia, I've found that kidney stones are very prevalent. I think a lot of it has to be made with diet and what we drink, but a lot of it also probably has to do with the fact that we are in a warmer climate. And I think as climates get warmer, we'll find more and more kidney stones because of insensible losses. What I mean by that is that throughout the day we lose water, and particularly in warmer climates, we lose more and more of it. So we are more dehydrated than you would expect in other areas. So my biggest thing I tell people is that the most important thing to do to avoid kidney stones is maintain your hydration. Make sure you're drinking enough water every day. Um, Things such as water with lemon help with avoiding kidney stones. I also recommend avoidance or at least moderation of dark liquids such as coffees, teas, cocos, and chocolates, which are high in oxalates, as well as a healthy dose of moderation when it comes to deep green leafy vegetables like spinach and kale and escarole. Those again are high in oxalates, which can lead to kidney stones. Kidney stone treatment has become a lot more manageable, and that's because we have better and better equipment. We have surgical lasers, which we use. We have very small scopes, which we can put up towards the kidney. And there are even newer technologies on the horizon, which will help us deal with these very painful stones. Now, at Georgia Urology, one thing that I always like to brag about is that although we're one of the biggest practices in the country, we have a unique offering, our Stone 11 hotline. And for patients in the area, they can call 1-855-STONE-11 anytime, day or night, holidays and weekends, and we can get them in to see our Georgia Urology practitioners generally within 48 business hours. And for the patients who are suffering from a kidney stone, it can be a true lifesaver. So I'm very proud of that initiative we have in our practice. The largest kidney stone I probably treated was about 5 centimeters, which would be about 2.5, 3 inches. And when you have stones that big, generally we will go through the back to get at them and do what's called a percutaneous nephrostal lithotomy, where we put a tube directly into the kidney to remove the stone. Bigger stones, usually I refer to my partners who have a specialty training in something called endourology, where they may be able to go in and retrieve even bigger stones. Stones can be definitely problematic, can be painful. I luckily have never had one, but I hope never to have one. But I'm very happy to treat my patients who do. In general, when we decide between laser and shockwave therapy, I get that question a lot, is depending a lot of times on the position of the stone as well as the density of the stone. So in many instances, you can see a stone's density on a CT scan or on a plain X-ray. And if the stone seems to be too dense, we can kind of have an idea that lithotripsy, which is a non-invasive procedure where shock waves are shot at the stone through the skin and directly into the kidney, may not be effective because the stone is just too hard. So in those instances, a lot of times it makes sense to run a scope in through the urinary tract. Again, we don't cut you anywhere, we don't put any telescopes in your body or what have you, but we can run scopes in through your urinary tract and get to the stone and use, again, the lasers and the miniaturized equipment that we do have to break the stones out and take them out through there.